I'm Louise Thompson, and I'm a nurse. I have a long and varied nursing career, and I've worked at the Prostate Cancer Centre for the last 3 years. I worked in the research department and then took on volunteer coordinating, as one of our volunteers can attest to. And the resource center, how's that? Is that a little better? Okay. The resource center, and then just recently I took on one of the new programs, did a pilot project, and I'll tell you about that when we come to it. So, maybe I'll stand around here. Okay, so this is the new Prostate Cancer Centre, and just before I start, I'm wondering how many of you have been to the new building to either see your urologist or and how many to the Prostate Cancer Centre? Good, good. And how many to the old building that was on Glenmore? Yeah, so most of you, of course, have been to one place or another, and a lot's to the new one already. That's great. So you may not know that there's 40,000 square feet that the Southern Alberta Institute of Urology occupies. Of course, half of that is the doctors and their offices, and half is ours. And in the building here, we're just from sort of this line here over. We're on this side, facing Glenmore Trail, and the doctors face the hospital. They have the mountain view.
How far is it from Rocky View?
Pardon me?
How far is it from Rocky View?
This is the Rocky View right here.
Oh, I thought it was there.
Yeah, yeah. So we just have to go outside and run across the street. Yeah. And the end of the six, this is the parking lot number 1. So it's parking all the way up to here, 5 levels, and then offices on the top. And the far end from that line over is empty. There's lots of debate going on as to who will get that area. So it's a $26 million building, entirely funded by private and corporate donations. And it's a state-of-the-art facility. We have 17 urologists. 14 of them are adult urologists, and 3 are pediatrics. We have about 10,000 men and their families. And it actually should say men and women, because there are many women who visit the urologist also. But about 10,000 people come through every year. It's an amazing number. So we have community awareness and education, rapid access clinics to early diagnosis, a clinic for treatment options, post-op care, volunteers and staff to assist the newly diagnosed, advocacy, research, and the man van, which we'll talk about. So Rapid Access 1 is something probably many of you came to. It's only accessed with a referral from a family doctor, and then the patients come to the Prostate Cancer Centre for their initial visit, and they see the urologist who checks their PSA, does the rectal exam, and he decides who gets or who needs a biopsy. And it's from this clinic that the men go for biopsy. And since this started in 2005, it's reduced the waiting time for that first consultation from 95 days down to about 8.5 days. So it's really made a dramatic difference. We've assisted 8,925 men, approximately, so far. So after the biopsy, then men go back to see their urologist who talk to them about the diagnosis. And just to go back a step, about 1/3 of the men that come into Rapid Access 1 are referred for a biopsy, and then again, about 1/3 of those men have a positive biopsy. So then they go back to see their urologists, and the urologists often send them to another Rapid Access clinic that we have, or it's a program. And we have a medical oncologist, Dr. Dean Ruther, one of the urologists, and one of the radiation oncologists come to speak at this meeting, and we have that every 2 weeks. And right now we have anywhere from 10 to 13 men come each time. So then the Rapid Access 3 is the new program that I piloted early last year. And I just did it for 5 of the urologists to begin with. And that was going to see the men in the hospital and making an appointment with them to come back to the Prostate Cancer Centre. This is me teaching one of the patients. And taking out their catheters or staples postoperatively, going through what's happened and letting them ask any questions. And they had stats from emergency prior to that, and following the 6 months of the time that I was seeing those patients, it reduced the emergency room visits by 2/3 because people then had somebody to call and ask simple questions and just avoid that emergency visit or come in and see me. So we started with all of the most of the doctors in May 2010, and I see about 300 men a year. So we're rapidly getting rapid access clinics. Final funding is now close for the RAC 4 program, and this will be for erectile and continence issues. And that's just a clinic that would be especially for those issues so that men have rapid access to doctors for those problems. Right now, Dr. Lee has one of the only erectile dysfunction clinics, and he has a long waiting list. He's a very busy guy. He would help us out with this, though. And I'm sure you all know that we have the Elliott Fong Wallace is the radiology department that does the biopsies here in Calgary, and they do that on Tuesdays and Thursdays out of our clinic. And again, those have to be booked by the radiologist. We have the resource center, and we have a library with books, and we have a volunteer there most days that can talk to patients and families if they have any questions, or talk to them before they go for their biopsy. And Keith, who's here tonight, also takes care of our library on Fridays. Fridays is quiet. He doesn't see too many patients that day. Yeah. So this was called Wellness, but we have changed it to just Life After Prostate Cancer. And we're getting a great turnout every month for that now, too. About 30 people, men and their families. And that's partly because I'm telling them what a great program it is and how helpful I think it will be for them. And they are finding that it is quite helpful. We have 4 professionals that come and speak on those topics. Many of you might know Dr. John Robinson. He comes, or one of his grad students. Yolanda Liu from the Bladder Clinic comes and talks on continence. Nicole Koulios-Reed from the university, and a dietitian. A new program that we've just started, we had the first one in September, is just a workshop for couples. So it's only for couples. It's a very private time. We have it on Friday afternoons when there isn't anybody else around. Dr. John Robinson and Dr. Jay Lee speak at that. Dr. Lee's very entertaining. He's worth coming to hear. And they do questionnaires and a few breakout sessions, and just go through this in about a 3-hour workshop. We've only had one so far. We had excellent reviews. We have another one in January, and we hope to have it about 3 times a year. And that's because it's hard to coordinate these sought-after doctors. In the resource center, we have peer support provided by our prostate graduates, which we now call them. And then this is about the Man Van. The Man Van is Canada's, North America's first and only PSA mobile unit. And how many of you have seen the Man Van around? Or, great, yeah. It still surprises me when I say something about it and people haven't heard of it, but it's getting to be more and more well known, and we have tested 4,700 men approximately to date. You see yourself there, Keith?
Yep.
And the blood samples are brought back to the Prostate Cancer Centre. We have 4 machines there, and with this equipment, the blood is spun and put into these machines, and we can do a PSA result in about 15 minutes. On occasion, when we have the machines all calibrated and things, we'll do a PSA for one of the urologists and have a turnaround time of about 15 minutes. But when we have 50 blood samples from a clinic, it makes more sense to just take all those blood samples from the Man Van back to the center and do all of them at one time there, and then let everybody know. We did try and phone everybody, but that's an onerous task with trying to get hold of people. So we now mail out all the normal results, and patients are told this, or the clients. And any abnormals, we call and speak directly to the patients. And we also provide speakers and educational booths for community groups and events.
Could I ask a question?
Sure.
There's been lots of controversy with a report from the United States about screening the population for PSA.
Yes.
What percentage can you say of 4,700 have been diagnosed as being active candidates for further biopsy, and what percentage, say, should be put onto an active surveillance type program? And what have you done to follow up on the patients that have just had one test, where active surveillance is maybe something that should be considered?
That's a complicated question, because if it is elevated, we contact the family doctor and put it back in the family doctor's hand, because we're not out there to gather patients. We're out there as an awareness program. So that's put back to the family doctor, and then it's their decision with the patient. And of course, the rectal exam is also important to try and decide what the best course for that patient is. If the patient does not have a family doctor, then Dr. Jablonski will take them on and make that decision. But that becomes patient confidentiality too, and we don't know the results of, we know how many are positive, but we don't follow them all the way through. That goes back to their doctor.
So relative to the controversy then, that's a gap in your information.
And why would you say it's a gap?
Well, there are those that are saying that the single test is not sufficient, and therefore why do many screening at all? And that is a very recent report from some learned group in the United States.
Well, our physicians would argue the learned group a bit. They are very annoyed with that. PSA testing is one of the only tools that we have to test for prostate cancer. In years gone by, before the PSA test came along, there was a much higher percentage of men dying of advanced prostate cancer because they weren't diagnosed early. They didn't have the opportunity to go on to active surveillance or be treated. The United States operates on a very different basis. Doctors there can advertise, and they have their own diagnostic machines that they can charge patients for, and they want to treat to make money. So they work on a different basis. Our doctors do not agree with that study. They think it's very biased.
Louise, there are doctors in the States who also disagree with
Yes, that's true.
But relative to your program,
Okay, our program.
I think there still is a gap.
We recommend, sorry,
And,
Yes, go ahead.
and that gap would be that you're not following up, or you're not engaging your family doctor to follow up with the second and the third PSA tests. I haven't heard that from what you're doing.
You can't do that.
Yeah.
I don't think you can do that under the Privacy Act.
If we're following them, if they don't have a doctor, they become one of these urologist patients right away, they are followed.
That's
Yeah.
correct. But
Yeah.
with the family doctor, when you send that information to the family doctor,
There's only
your feedback stops.
yes.
I found that
Yes.
you gotta take it in your own hands and have your family doctor say, hey, I got this thing from my
Yes.
oncologist and he says I'm supposed to be getting a test. Can
Right.
you arrange this test for me? And I found that that's the only way I'm getting mine done, is I have to follow it up. I have to-
unfortunately-
my doctor's more than willing to do it, but
Yeah.
he can't remember everybody. And, you know, I gave him a schedule of what I was supposed to do for the next 5 years, and I have to keep reminding him, and he thanks me for it, but, you know, I have to do it.
Yes, and some doctors don't agree with doing the PSA test, so that patient would have to take the responsibility to find a doctor that maybe would. And this is an awareness program. We're trying to get men aware of the PSA test, aware of prostate cancer, and that.
Following up on what Stuart said, what capability do you have, if not to follow up, to communicate on an ongoing basis with the people who present themselves to the man van, so that even if they have a relatively low PSA, it becomes their baseline. And from anything I know, you know, in general, and from my situation and most people here, it's the time series. It's not the absolute reading of a PSA, but it's the changes in the PSA. So do you have the ability to communicate with people who present themselves to the man van 1 or 2 years later, saying, you presented yourself to the man van in 2011, it's not 2013. Have you had a follow-up? Do you have the ability to communicate with them?
Well, I guess we do have their names and addresses, but that would be a very onerous task with the number of men that we see. It's an awareness.
That onerous, you know, if you automated it, you know, that there was a follow-up, because I think the time series and the change in PSA is.
But we're not taking these patients on as our patients. It's an awareness program. We are trying to create the awareness.
But if it's one point in time awareness, and people drop it, particularly if they have a very low or almost invisible PSA, and they're 40 or 45, you know, what incentive by your initial awareness is there to follow up? Even if your follow-up is you saw us in 2011, have you followed up with your doctor in 2013? You know, you don't need a communication back to them, but you've engaged in further awareness. And I think this ongoing awareness and the time series are critical issues to make the man van be a useful tool.
I have to agree.
Do you have a piece of literature?
How much would that cost? We operate on donor dollars.
would we give anybody that comes in to be tested, if anybody here has ever been into the man van, you get a little, like a card, a pocket thing that like comes with your insurance stuff and whatever, and when you're encouraged and recommended to put when you get your result, to record it there. And anybody over the age of 50, it's recommended that they get a PSA test every year. And like this gentleman over here said, there's a responsibility on each individual. We don't have the capacity to do that right now. The man van is an awareness tool, it is not to replace the doctor and your relationship with your doctor.
I'm gonna steal it for a second. And Stuart and Ron, be nice. No, tell you what, you know, like, you're right. Yes, they're going to start a fundraiser, I hear, to raise money to institute that program. No, fellows, now look, I mean, Louise is here to talk about, you know, a lot of the outreach activities and resources. In my discussions with the center, they're well aware of these. I'm standing right in front of the mic, it's really annoying, or the speaker. They know this stuff. They know what they need to do, and the advocacy with... So you're talking about two different things, right? PSA, advocacy with people, but then there's also the doctors too. And they know, as we know, that our organization has to get better at talking to the doctors and educating them, and the center is working on that too. But that's totally separate from this, right? The doctors need to learn the value of PSA testing, and I think that's the biggest thing you're getting after, right? Once they hand it off to the doctor then has to be educated enough to carry it from there. So that's a separate issue, but they are working on that just as we're working on that. So let her be, let her be. It's okay.
It could be another program.
I agree. But it's a good point. Oh, you know, I mean.
Bad boy.
So this is another new initiative. Sarah Geddes is running this from our center, Combines for Cures. And it's a new initiative for the rural areas to provide access for comprehensive prostate medical care to men in rural areas of Western Canada with an awareness campaign, education, and taking something like a second man van out to the rural areas. They've started a feasibility project to determine the scope of this. It hasn't started yet. They're just working on looking into doing it. But it has funding. So something will happen. We also have a research component at the Prostate Cancer Centre. That's where I started working. They do a number of studies, both with prostate cancer and erectile function and bladder cancer, and anything that the urologists get passed through ethics. And a second component is the pathologist. This is Dr. Tarek Bismar. There are 3 excellent pathologists that work out of the Rocky View Hospital, and they are doing some research projects in our center, working with us on a genetic program. So this is the waiting room at the Prostate Cancer Centre, and it just shows all the names of the donors who have donated sums of money to keep us running and create the new programs. So some other highlights. We have state-of-the-art audio-visual teleconferencing equipment in the conference room, and that enables us to reach physicians in other locations, and we take part in the tumor rounds with the Tom Baker Cancer Centre every Thursday. The doctors can come in there, and the oncologists and the surgeons can discuss difficult patients and decide what the best course of action is. This will also be valuable for the rural initiative. Petitioning the Alberta government to fund the PSA testing, and that was completed as of April 2011, and the current petitioning for the erectile dysfunction aids. And we're considering things more than just the pills, some of the other aids also. There's a Twitter site launched in September with 297 followers. Facebook page has 219 Facebook friends. We've had some of our brochures translated into Chinese by a urologist from China, and we're currently working with Prostate Cancer Canada for translation for most of our brochures into Punjabi, French, and Korean.
If I may, just before you go off that slide, one of the curiosities that I found in the second bullet point,
Yes.
in literature from Alberta Health Services, quoting the director of screening, that they do not yet recommend screening for PSA. And that's very, very current literature, published by Alberta Health Services with all of the officiality associated with that. So while the government presumably has begun to fund the PSA testing, it's not recommended.
I believe they're talking different age, 40 years old. Or
It's
50
just
years.
plain blanket, they're not recommended by the director of screening for cancer or whatever. So I just put that as an observation.
Maybe we need to petition for that too, eh? Yeah, it's a very controversial issue. And many of you may have heard of the Prostate Cancer Awareness Week. We did the Guinness. It's still an unofficial world record, but there's nobody else who's tried to do it. So as soon as everything gets written in stone, we will have the official world record. We had over 1,000 men come that day, but we could record 988 men for being tested between the times. So get checked. Okay. Any other questions?
Yes. Louise, just curious, now you sponsor quite a few new programs, and it's very commendable. I'm just wondering whether you will be any duplication, between Rocky Mill with Tom Baker.
If there will be any duplication? At this time, there's not. No, we work very closely with them. Their doctors come over and speak at our programs, and their patients are welcome to come to our programs. But it's a pretty separate treatment group.
You mentioned Rapid Access 1.
Yes.
Approximately 1/3 of the men that go there get referred for biopsy.
Yes.
What happens to the other 2/3?
There's a number of choices. They can be referred to have a second PSA test or another PSA test if they don't believe they've got enough to look at yet. Some are asked to come back in 6 months. Some are asked to come back in 3 months. And some are just saying, no, you don't need a biopsy. Yeah.
Okay, that sounds good.
Yeah.
Now, when you go to Rapid Access 2, is there any discussion about active surveillance? Or is it
Yes, definitely.
Very good.
Yeah.
Very good.
Yeah, and you're welcome to come to that anytime if you'd like to. It's a very educational session. Yeah. They go over prostate cancer, active surveillance, surgical options, radiation options. They don't talk about advanced cancer at that point. Yeah, no. And maybe that's the only duplication, is that some of the urologists are giving Eligard in their offices, and the Tom Baker is also doing that. That's, yeah.
All right, any other questions?
Just one question.
Okay.
Just for information, is this center different from Tom Baker?
Yes.
Yes.
Tom Baker is part of the Alberta Health Services, and this is a not-for-profit center. the urologists work with us, but yeah, the center's services are provided by donations.
All right, a big hand for Louise. Thanks for sharing an update of the, what's going on at the center. The big thing to remember with this center is it's privately funded. This doesn't see, government money, any more than we might get the odd tiny little grant from the government, that sort of thing. But like us, it's not government funded, so it stands a testament to our city and our province of what we're able to provide, everyone without much help in that regard. And, like we talked about with advocacy and PSA and everything else, it always does seem like a bit of a fight between us and the government. So, they're up against that just as much, and in a lot of cases more so than Prostate Cancer Canada Network Calgary. So, amazing work you guys are doing. So up next, I have Ann Walker from the Canadian Cancer Society.
Thanks, everybody. Thanks, Jason, for having me tonight. I thought one thing that Louise said that was quite interesting is she gets to see 300 men a year. I thought that was sounded kind of fun. I'm really happy to be here talking to the Prostate Cancer Canada Network. And Jason just asked me to come and share with you what the Canadian Cancer Society does, and try you to just know a little bit more about us. A lot of people, of course, I would guess everybody in the room has heard of the Canadian Cancer Society. We've been around for over 70 years. We're the oldest cancer organization in Canada. But what do we do? People don't really know. And a lot of people think we just sell daffodils. A lot of people know that. We sell daffodils, and certainly that's kind of our trademark, the daffodil. But I just want to let you know about what we do. We do like you to think about us as your best partner in the fight against cancer. We do a lot of partnering with organizations such as Prostate Cancer Network. You're not hearing me?
No, is it turned on? Maybe just...
Sorry. How's that?
No.
How's that?
Yeah.
Sorry. So we partner with lots of organizations, and we're always trying to look for gaps, see if we can't fill the gaps. We try not to duplicate where people are already doing. We do have a lot of impact on cancer in every area in Canada because we're a national organization. And we do everything we can to prevent cancer. So we do have a lot of prevention messages. A lot of what Louise was saying is very similar to what we talk about. And we also offer a lot of meaningful volunteer opportunities. The gal at the top there with the dark hair, I don't know if you can really see her. She's my hairdresser. I did a head shave myself, and she's now my hairdresser. She shaved my head. But, yeah, that was fun. Yeah, it was an interesting. That was exactly a year ago that I shaved my head, and my family thought maybe I'd gone nuts or something. But I really expected to feel exposed and vulnerable when I had as a woman with a bald head, and I ended up feeling confident and empowered, and that was a real surprise. It was, people just came out of the woodwork. We just did it via emails, and my mom emailed everybody, and my brothers and my kids, and people just came out of the woodwork. And it's because everybody has a reason, right? Everybody knows somebody. We were just amazed at how many people, and we kind of combined it with a little Movember event because a couple of the guys had the mustaches. It was December 5th, so a couple of guys saved their mustaches for our little head shave event, so it was quite fun. And it all grew back. I used to be a redhead, but... So we are a national organization, community-based volunteer organization, and our mission is the eradication of cancer and the enhancement of the quality of life of people living with cancer. So, fairly lofty goal, eradication of cancer. I really, really, really want to be around on the day that we're all out of jobs. and that we don't have to do this anymore. I'm not really sure it's going to happen in my lifetime. The part of the mission that actually speaks to me is more about the quality of life of people living with cancer. My work has me, my portfolio is support and information. So I do a lot of talking to healthcare professionals to let them know what we can offer their patients. I talk to the general public. I do all sorts of wellness initiatives, and I do a lot of work with volunteers as well. So that's the part of the mission that I focus on, enhancing the quality of life. That's just a little snapshot of our values: caring, courage, integrity, and progressive. And our vision is to create a world where no Canadian fears cancer. And I think we're getting a little closer. 40 years ago, if you were diagnosed with cancer, there was, I think, a lot more fear associated with that than in some cases now. Not every case, of course. And it's still a scary thing. But 40 years ago, it really was just a death sentence right from the get-go. And we've come so far from that. We have been around since 1938. The Canadian Cancer Society actually started in Alberta. 2 doctors in Medicine Hat started the Canadian Cancer Society. Long time ago. So some of the initiatives that we work on is the prevention, funding research. A lot of people think that's all we do is just raise money to fund research. And we do a lot of empowering and informing and supporting Canadians through their cancer journeys, and trying to mobilize Canadians to make cancer history. Some of our print material that we've been doing lately, and we don't do a lot of television advertising, it's too expensive, but some of the stuff you'll see from us is a little bit of a harder edge to it now, a little bit of a, we've been doing this for a long time, and we're getting a little ticked off at cancer. So some of our messages are, you know, cancer, don't mess with us. We are the largest provider of information and support and free services to cancer patients and their families. We do a lot of sharing our stories and supportive programs such as this. What this is to me is peer support right here. And you mentioned peer support, Louise, and we have some peer support programs too. And just letting people be comfortable sharing their stories. And that's all some people want to do. We've talked to a lot of young adults with cancer, and really they just want to be heard. They just want to talk about their story and be heard is a lot of what we've heard from them. So certainly providing people with an option for that. We do have a program called Cancer Connection. And that is our peer support program where we have screened and trained volunteers that they've been through their cancer journey, they want to come back and help the next person. Usually for 2 reasons. I do a lot of training of the volunteers, so I see a lot of them. Either they felt so alone when they went through their cancer journey that they want to help the next person, they don't want anyone to ever feel that alone. Or the exact opposite, they were so overwhelmed by the amount of support that came to them that they want to pay that forward. So that's usually the 2 reasons our volunteers come to us for Cancer Connection. So we screen them, and just like we would an employee, criminal record check, all that stuff, and then we train them to provide this peer support. And most of it occurs over the phone. So the volunteer, the patient will call to us. We'll figure out what it is they're needing, what they want to talk about, what their issues are. Then we'll look in our confidential database and pull up the volunteer that best matches. So maybe it's a gentleman with prostate cancer, and he wants to actually, often with the prostate boys, we will match them up with 3 different gentlemen, because they want to talk to someone that did the brachytherapy, they want to talk to someone that had the surgery, and they want to talk to someone that did the radiation, right? So we'll say, well, we'll let you talk to 3 guys, and you can get talk to them, see what they say, ask them that question, would you do it again, or and just so that they can make an informed decision. So for prostate, we do often hook them up with 3 volunteers, or it might just be someone that wants to talk to someone that's their age, same stage in life. How am I going to talk to my teenage son about, my prostate? That might be the issue, right? So we connect them up with volunteers that can speak to whatever the issues they have. We usually try to connect people in their same city. So if a Calgarian calls, we will try to find a Calgarian. But if we don't have the right volunteer in Calgary, we'll expand our search to other parts of Alberta. If we don't have a volunteer in Alberta, we'll look across Canada. This is a national program. So we might end up hooking them up with someone in Vancouver or Manitoba or someplace. And because it's mainly phone-based, there's no cost to the volunteer or the client. We pay all the long-distance charges. And essentially, we give the volunteer a calling card. And so you can use the calling card when they're making the call. There's no cap on how long they can talk. There's no cap on how many times they can talk to the patient. We do, because we're donor funded, we do our due diligence and we actually check the phone bills. It used to land on my desk. I don't work that program anymore. But you know, we can see what numbers they've called and how long they were on, and we would check that phone bill just to, we've never had a problem with it, but just to make sure. So that's been a great program, Cancer Connection.
One thing I didn't hear, I'm at stage 4. One thing I didn't hear is, would I have anybody to talk to there?
You'd have to phone them and ask them. We have volunteers all over the map. I can't say for sure. But it would be worth a call. And you know, if we don't have the right volunteer, they don't just hang up and say, sorry, can't help you. They'll look for other resources for you. Yeah. We also have some groups going on in Alberta, Inspiring Hope group series. They're a little patchy. We have some of the same challenges that your organization has, in that we don't have access to the Alberta Cancer Board's patient registry, so people have to find us. So you'd think in a city the size of Calgary that we could pull together 10 or 12 people for a, you know, breast cancer support group, or, you know, just a general living with cancer support group, but we don't have as much uptake on this in the large cities. I think there's a lot of other organizations and other options for folks. You know, for prostate, of course, a lot of people end up coming to you folks, and that's fantastic. Wellspring is out there. They do a wonderful job at supporting people. We've had better luck, actually, in our Inspiring Hope groups in the rural areas. That's where people are really, really sort of desperate for anything. There's just not as much available to folks. So we do have different groups going on. Right now we have a breast cancer support group being delivered in Cantonese here in Calgary. So the Calgary Chinese Community Services Association came to us. We provided them with the material. We trained their facilitator and we trained their volunteer. They translated all the materials, and they've got a group of gals that are being supported in their own language with our material. So that's a great example of us partnering with another agency. We do have, that's just the Inspiring Hope website for our groups. We have some really good support for families facing end-of-life care. We have a new fund called the Compassion Fund, and it allows us to help folks that have been diagnosed as palliative with some of those end-of-life expenses that just aren't covered. Okay, I sent a check to a fella today, rural. Had to take an ambulance. He's been at home, but he had to get an ambulance for some kind of, I'm not sure what exactly he had to come into Calgary for, to the Tom Baker, but the ambulance wasn't paid for. That's a big chunk of change from Crossfield or wherever he was from. And so we can pay for some of those non-emergent ambulance services. We can pay for dressings and those kinds of things that aren't covered by Alberta Health Services. And in fact, we look at everybody just case by case. Sometimes it's house cleaning, if that's what they need. They're palliative. We get referrals from palliative care nurses and palliative care social workers. And it's not a bottomless pit. We have $900 a year per person for that fund. And it's fairly new, but it helps quite a few families. It's helped in the last few months or weeks of their loved one's life. So that's a good fund that I'm happy we're able to provide. We also have another financial assistance program. This one is really about travel and accommodation. So for folks that are living here in Calgary, not really an issue, but for Albertans that have to travel to either Edmonton or Calgary or now Lethbridge for cancer treatments 5 times a week for 5 weeks, and they're traveling from Lac La Biche to Edmonton, and now they have to stay in a hotel. And a lot of them will come into the center for the week and then go home on the weekend. A lot of traveling back and forth, and hotels, that adds up real fast if you don't have any family to stay with. So we have a lot of partnerships with some hotels that give us a great rate. We have some hotels that actually give us a free room if it's available. I'm not telling you the name of that hotel because I don't want to field any calls. It has to come through us, right? But there's a hotel in Calgary and Edmonton. You know, in the middle of Stampede Week or Klondike Days, they won't have a room available. But if there is a room, they will give it to a cancer patient for free. So that's through our financial assistance program. And also we cover mileage, so we can just pay people mileage from when they're going back and forth, or if they end up taking the bus or the LA shuttle to get from Lethbridge to Calgary, whatever, we can help with those kinds of funds. It's just another huge expense, all that travel.
What do you call it? Foothills Hospital used to have free rooms there.
Which one? The Foothills. Yeah. The hostel, the South Tower, yeah, just behind the radiation department there, that's the South Tower. And you're right, they do have a hostel there, 2 floors, I believe, where they give rooms to patients and their family, their caregivers. Very, very reasonable. Don't quote me, but I think it's like $25 a night or $20 a night. It's very reasonable. And actually the Canadian Cancer Society helps to fund that.
Yeah, not only there, but there's one beside where the women's shelter, not shelter, women treatment cancer center there on the side. When you come in, it's on your right. Because
the women's center, the women's health center at the.
They used to have 20 rooms one time.
Oh yeah, I'm not aware of that one. I know that the South Tower at the south end that overlooks the escarpment, it's an old nurses' residence, so it's perfect for that. And then actually the 14th floor is for bone marrow transplant patients, where they have to keep it really pristinely clean for those patients. So there's some good opportunities there for folks in need.
I perhaps missed. How do people become aware of that service?
I go out and talk to the healthcare professionals and the nurses and oil companies, and you know, this is what I'm saying about the Canadian Cancer Society. People know us, we're well known, but they don't know what we do, right? We're well known, but we're not known well, right? And it's that social marketing that I'm sure you guys are aware of that's so difficult. Why would anyone even want to talk about cancer or think about cancer until they have cancer? And then it's this, you know, this flood of emotions and fear and all of that, and the family, everyone telling you what you're supposed to do, and you know, it's craziness. But people don't discuss it or want to talk about it before they need it. It's just the way we are as humans, right? You know, maybe we'll dodge the bullet and never have to discuss it. And then there's that day that someone you know gets diagnosed, or it's yourself, and that's where you need to know this stuff. And it's interesting. I'll say to people, did you think to call the Canadian Cancer Society? No, I didn't. It's like that Rice Krispies ads, right? What did you think it was made out of, right? You know, like we're there to support Canadians, and a lot of people, it doesn't even occur to them. They think we sell daffodils. And we do. We do more than that. We have this little patient care kit. I've got a whole bunch of them at the back. If anybody thinks that this would be something that would be informative for themselves or someone that they know, with cancer. It's just information. It's not prostate specific. It's general cancer information that's in this kit. They're free of charge, and my mission in life is to get them out to people diagnosed with cancer and family members. So that's just a little snapshot of what's in there. There's a nice water bottle. There's a little notepad. We have a lot of print materials. There's some on nutrition and living with cancer and those kinds of things. We actually have Our Cancer Information Service is a great resource. Healthcare professionals use it. I use it. The general public uses it. The number for our Cancer Information Service is printed on everything we do. And the Cancer Information Service provides a lot of information to Canadians. Millions of copies of hundreds of different titles. The one that I got today that it's on my table back there is a new one on prostate cancer that I hadn't seen. It's an updated one. But I call the Cancer Information Service everything you ever wanted to ask about cancer but were afraid to ask. Right? Everything you want to know about cancer but were afraid to ask. They have current and valid information on cancer. So you know what happens when you Google prostate cancer. You get some weird little websites popping up and you know who's selling you what and what's that. This is current and valid information. So I encourage people to take a look at, phone that 1-800 number that's on the back or go to our website. We offer the Cancer Information Service in several languages. We have a translator in the north that can translate in 11 Aboriginal languages. Plus we have publications in Punjabi and Cantonese, Chinese, French, English, quite a few different languages, so that's good. Anyways, these are free for the asking. My mission in life is to get these into the hands of cancer patients. So if you think this is something you might like, take one. I see there's only about 4 or 5 on the table there, but I have more underneath, so please take those home if you think that's something that would be useful to you. There's our little bit of our cutting edge. Hit the road, cancer. We've had enough of this cancer stuff. But while you're hitting the road, you might want to access our volunteer driver program. Now this is one program that has taken off. We've been doing this for a long time, more than 20 years, volunteer driver program, and people seem to know about this program. The gals at the radiation department at the Tom Baker are probably our best advertisers because they see people that are riding the bus to get to treatment or, you know. But our volunteers are awesome. A lot of them are retirees, not all of them, but they will pick people up at their home, bring them to the treatment center, wait for them, and bring them home again. They do get a rebate for mileage, and they have to have a certain amount of insurance and liability on their vehicle. But they do get paid back for mileage. A lot of them just donate that back to us. But we don't want it to cost you money to be a volunteer. So they're using their own cars. All of the requests for rides have to go through our call center at our office here in Calgary. And the gals do an amazing job of coordinating the hundreds of people that are calling every week to get rides. What happens is they're always working on next week, right? So this week they're working on getting next week's schedule. By Wednesday, that schedule will be a thing of beauty. They'll have it all arranged, and by Thursday it'll fall apart because, well, the machine goes down, or a machine's down for maintenance, or a driver gets sick, or or the doctor says, oh, we want to see them for blood as well. You know how that goes. So, but those are staff members that put the program together are amazing. They do it all with such grace and a sense of humor. If we've promised a ride, that person will get a ride. So if the volunteer phones in sick, and of course we tell the volunteers you can't be driving when sneezing and coughing, you can't. You have to call in sick. So if a volunteer does call in sick, we'll try and scramble and find a volunteer. We have a few taxi chits in our back pocket that we can use, and then we might get them there and then try and still scramble to find a volunteer to bring them home. But if not, we'll put them in a cab if we have to. It's a great program. It really, some people, one lady told us, I was trying not to use it. I thought maybe I didn't need to use it, and maybe other people were more needy than me and I shouldn't use it. And then she finally found a day that she had to use our program, and she couldn't believe she hadn't done it beforehand, because it just alleviated one more thing off her plate to worry about. We all know what the parking situation's like there, right? So all of that, no worries. So it's a good program. And it's free of charge.
What's your supply of volunteers? Do you have adequate volunteers?
We always need more volunteers. A lot of them go down south for the winter. You know, we have quite a few snowbirds, but we always, because the more volunteers we have, the less people will have to turn away. We need, people have to give us 2 full business days notice to get a ride. So if they call on Friday at 4 o'clock for a Monday morning ride, probably not going to, you know, we have to fit it into the schedule and then get a confirmation from the volunteer that they can do it.
In terms of potential volunteers, have you ever heard of volunteers running into any difficulty with their insurance company because they're using a vehicle for other than personal use?
I haven't. I think in general, and don't quote me on this, but I think usually you let your insurance company know that you're using your car for volunteer purposes. Like I know when we were driving brownies or Girl Guides or whatever, that was what we had to do. And they do have to have a certain amount of insurance and liability on their vehicle. Yeah. But we haven't had any problems with insurance companies. And we got, you know, our legal guys are all over it. So, yeah. It's been a great program. And it's also seems to be one of our really most popular volunteer experiences, right? The volunteers get a lot out of it themselves. They really enjoy that one. We run a little wig bank in our Calgary office. Do you folks know where our office is here in Calgary? Do you know where the Calgary Herald is? We're right next door. Well, there's sort of a building in between. So we're up there off of, you can see us from Deerfoot Trail, just off of Memorial Drive. Yeah, right near the Calgary Herald. So, and we moved into that office a couple years ago. If you've come there, you might think it's kind of cushy and how do you guys afford this? But we actually save $250,000 a year by owning our own building. Rather, we were renting spaces in 2 different locations in Calgary before that. You can imagine what that was costing. So it's kind of like a condo arrangement where we own the 2nd floor. Yeah, and we save $250,000 a year. Anyways, the wig bank is up there at our Calgary office, and this is just an opportunity for ladies who have lost their hair due to chemo to come and get a wig. Wigs usually run, you know, $400 or $500. Another expense. And for the gals, the bald head is such a public announcement that they're a cancer patient, and not everybody's ready to go that public with their health concerns. So we see a lot of people just walking a little taller coming out of the wig bank, and we have some fun in there with them too. Often they'll bring their girlfriends or their mom, or you know, and it's kind of fun. Some of the wigs are just like bad, you know, they look bad, and we laugh and we find the right one for them. That's good. So we do operate that in Calgary and in Red Deer. In Edmonton, they actually operate it in the hospital at Edmonton, but I believe we fund part of that one. So again, we wouldn't duplicate a service, right? Edmonton had the wig bank. We just help support that for them. The Cancer Information Service, I already talked about it. I use it myself. I encourage patients to use it. Sometimes even with our peer support programs, it's not always about answering all the questions for the folks. It's about empowering them to go and find out. And I found even when I have gone to the Cancer Information Service to ask a question on behalf of a patient, it's better if I just have the patient, because they're going to ask me some other questions I don't know, and then I won't be able to speak for that patient. So it's always better to just get the patient to make the call and find out. And you know, if they certainly can talk about the lingo that the doctors are using, and the you know, what the side effects of drugs are, or what the contraindications of drugs are, what foods you may or may not be. They have a lot of that kind of information, but they also have information on what else is out there. So the Prostate Cancer Canada Network would be on our Cancer Information Services, so they might end up directing people your way or to any other organization. Toll-free number. More on information. We have so many publications. Or you can do it the modern way at cancer.ca. And you can see a list of our publications on our website. Most of the titles are pretty self-explanatory. We do a lot of work in prevention. One of the brochures I have on the table back there is early detection screening. I brought the women's early detection screening because I figure all you guys have loved ones, wives, daughters, mothers. I don't know why I usually bring the men's early detection screening, and somehow it didn't make it into my box. But the message that Louise was talking about the early detection, it is the key to cancer survival rates. And it's just an awareness. The women are getting their pap smears and their mammograms, and we're sending men for the, the finger test and all of that. And it's just making sure that people are aware of any changes in their bodies. And that's kind of the new messaging. For women, they used to talk about self-exams for their breasts and that kind of thing. It's really anything that's different. And while I'm talking about that, and since it's men, one of the ones that really alarms me is this testicular cancer. And it's hitting young men, 15-year-olds. 15 to 30-year-olds are getting testicular cancer. And we need to train them the way we've trained the women to check, the women have learned over the decades to pay attention and to check themselves. So we're trying to train the men to do the same thing. And it's just a self-examination in the shower. And again, looking for something that's different. Guys can often just say, oh, well, I was playing ball, it's a groin injury, or pass it off as something. It's one of those cancers that find it early, deal with it, done. Yet, if it's left undetected, it's a different ending to that story. So we really do a lot of prevention messaging. And one thing that I wanted to, I'm really glad I had this slide here, because we have this thing called Cancer Fight Club. And what it is it's a website that you can sign on to free of charge. They're not going to ask you for any money, but it reminds you. You punch in your gender and your age, and it'll send you an email based on when you should be getting different tests, and it'll remind you every year. Or like, okay guys, you're 50 now. Time for the finger test, or So it is called Fight Club. This is just talking about it again for the men. You just get this annual reminder. So that might be a good follow-up to your van. Somebody was talking about an automated. Again, it's up to the patient, the general public, to sign up. But then you get that little email that reminds you, and for women as well. So we want to prevent cancer by educating Canadians. Again, I just can't say it enough, early detection and screening. It's so huge. And also we do a lot of promoting healthy lifestyles and advocating for healthy public policies. Now, does anybody have any idea of how much government money the Canadian Cancer Society receives? Zero. Zero government dollars. A lot of people are surprised at that. They say, what the heck? But it does actually work in our favor, because we do a lot of advocacy work where we lobby government for healthy public policies. The smoking bylaw that was enacted in Alberta in the last few years, the restaurants and where people are working shouldn't have to deal with secondhand smoke. The Canadian Cancer Society was at the forefront of that, along with Heart and Stroke and the Lung Association, right? And even ADAC, what used to be called Alberta Drug and Alcohol Commission, right? But ADAC was a provincially funded, and they wouldn't be able to speak out against the folks that are giving them a paycheck, right? So the Canadian Cancer Society is able to be the voice on some of those initiatives. And just for the record, the smoking one took 50 years. We've been doing this a long time, so it's some of those, I don't know what the word is, but it just takes a long time to change some of people's attitudes and people's values, and yeah, change doesn't come easy. But they fought. They kept fighting for 50 years. They've been fighting because they knew 50 years ago that cancer was causing, that tobacco was causing cancer. There's still a fight with tobacco. Because the tobacco companies, you know, they just get in there and find a little loophole, and sure enough, they found a loophole in our last piece of legislation that we moved through, which was about flavored tobacco for, you know, and they're targeting children. Oh, well, we don't target children, but it's bubble gum flavored. You know, and so I think they got, the legislation was about the size and the type of tobacco. They have these little things, they're like the little cigarellos, and they're flavored. And you should see how they package them. They look like magic markers. They sell them one at a time, so, you know, the 16-year-old can afford it, $2 for one. And it looks like a lip gloss. If I was a mom and my teenage daughter had one in her purse, I'd think it was lip gloss. And they're grape flavored and different flavors, but they're not targeting kids. But they did, when we got the legislation in about flavored tobacco, there was some little loophole where they could build a different kind of cigarette with a different, and package a different size. I don't know, they found a loophole and they're still selling flavored tobacco. And the spit tobacco, you wouldn't believe, I don't do this advocacy work, but you wouldn't believe the numbers on spit tobacco young people in Alberta, and Alberta is way up there above the rest of the country. The spit tobacco, yeah. Anyway, so we are there lobbying government. The other one is the access to drugs. And that's the one thing that we can't do any funding of. I can't help anybody pay for drugs. And the reason for that is because we're lobbying government to get equal access for all Canadians. Sometimes the drugs that are available are based on your postal code. Because in British Columbia, you can get some drugs that you can't get here in Alberta. What's that? So we're lobbying government, and if we start funding people for their drugs, then we sort of get the government off the hook. So no, we want to keep the government accountable, and we will continue to fight to get access for drugs to Canadians for cancer control. There's the women's one on the Fight Club. I was just talking about the advocacy work we're doing. Cosmetic, pesticides, you're going to be hearing more about that. Medications, I just mentioned. We do a lot of advocacy work on the right to know what's in the products. I think some of the stuff got pulled off the market for pesticides because of some of this work. So yeah, this is kind of the big one. You hear a lot about this pretty soon. I think that's just about it. I don't want to, this presentation actually has a bit on fundraising, which I'm not doing. I think that's about it. Research. Of course, the funds that we do raise, a lot of it does go. We are one of the largest funders of research in Canada. Some good work done there, and a lot of breakthroughs have happened. Clinical trials. A lot of the money that we raise here in Alberta stays in Alberta. Some of the work that we've done there on research. T-cells. This one's a bit controversial, but it's saved lives. This HPV vaccine. Lots of work been done in the area of brain cancer, and this is Dr. Peter Forsyth is at the Tom Baker. So we are the largest national charitable funder of cancer research. I think that's about it. Yeah, 80% still goes unfunded. Like, there's lots of good projects out there that never see the funding. It's unfortunate, but there's only so much money, I guess, eh? Oh, there was a really good tobacco statistic. Tobacco companies spend the same amount of money as the Canadian. Okay, think about how much the Canadian Cancer Society would spend in a year funding research. That's equal to what tobacco companies worldwide spend on advertising in a day. Just put that out there. There is good news, of course. You see it in the prostate cancer as well as other cancers. As I mentioned earlier, 30 years ago it was really almost a death sentence, and now we're seeing so many more people surviving these diseases. I think because of early detection and screening. Lots of different cancers that they've made a lot of strides in. If you take lung cancer out of the mix, you'll see that death rates for women have declined. The lung cancer is so preventable. A lot of cancers can be prevented through healthy living, and that's why we do so much work on public policies. There's no guarantee though, eh? You can be like the healthiest person in the world and never smoke and moderate drinker and physically fit, and you may still develop cancer, and that's kind of the frustrating part. But you can certainly reduce your risk if you choose a healthy lifestyle. Lots of strides made with the children's cancers. You all know why we fight this disease. The 2 in 5 statistic is frightening. Every 7 minutes, more than 2 Canadians are diagnosed with cancer. It's, like I said when I started, I really hope that there's a day when I'm out of a job and we don't have to do this anymore. I think that's just about the end. I think I'll stop there. The one thing that sets the Canadian Cancer Society apart from other organizations is that we do fight and support all cancers. Over 200 diseases, really. The other thing that's interesting is that there's over 200 organizations in Canada with cancer in their title. So you can see why people are confused about, people say, oh, I did the run for the cure. They're telling me they did the run for the cure. And I went, that's great. Money goes to research. But it's not our organization, and I don't know, you might get some of that too. But anyways, I thank you very much. Is there any questions or anything else I can share with you or enlighten you folks? I really appreciate your time. Please take a look at the materials on the table. Help yourself to one of those bags if you think it's beneficial. Thank you.